Hi, good evening. Today I will be talking about the Biopsychosocial Review of Cancer. My name is Analia Lopez and I attend Kaiser University in the class of Health Psychology. Cancer is a widespread disease. There's about 1.5 million new cancer cases in the United States in 2009. The worldwide death is 7.6 million in the year of 2007. It is believed that cancer is going to rise by 17.5 million by the year 2050. Now, research is being done by the American Cancer Society, but is not reducing the amounts of cancer as much as I thought it would. Cancer affects the patient both physically and mentally. So you might be thinking to yourself, what is cancer? So cancer is a group of different diseases that are all related to each other. In all cancer, it is found that the cells in the body begin to divide and it doesn't stop. Now, cancer can start in any area of the body, and cancers can form solid tumors, which are basically masses of tissue. In other forms of cancer, like leukemia, it doesn't form solid tumors. Cancerous tumors are called malignant when they begin to spread to other organs and tissues. They can also break off and travel to other areas of the body. There are over 200 different types of cancers. Now, the following are the 5 most common types of cancers. Skin cancer, which affects over 1 million people every year. It appears on the skin and it can spread to other parts of the body and even other organs. It's found in areas that have been exposed to the sun, and it usually affects older people or people who have been compromised their immune system. Lung cancer is the second most common. It affects the cells in the lungs and it's usually caused by smoking. Breast cancer, which is most commonly found in women, is the third. Prostate cancer is only found in men, and usually men over 50. And colorectal cancer. There's almost 150,000 cases of colon cancer every year. So there's biological causes of cancer. These are called carcinogens. They're substances, either chemical, physical, or biological, that cause cancer. If enough is introduced into the body, there's a higher chance of developing cancer. Common carcinogens are tobacco smoke, diet, different pathogens, radiation, and environmental hazards. Genetics also plays a part in how your cells divide. So genes are a part of your DNA, and inside each cell that tells the cell how to behave and how to grow and divide. Most genes are found in your chromosomes, which are long strands of DNA. So your genes have the capability of mutating, and this can affect the cell in different ways. Cells become cancer cells because of the mutations in the genes. Tobacco smoke. So there's a reason why there's the warning labels on the back of the cigarette boxes. There's overwhelming evidence that links tobacco smoking to be the cause of up to 40% of all cancer. Cigarette smoke has different carcinogens, and it can cause tumors to grow. It can initiate tumors. It can mutate your genes. And many of the chemicals found in cigarettes cause these mutations. Secondhand smoke, meaning people who don't smoke, that absorb cigarette smoke, are more likely to develop cancer than those who smoke directly. 30 to 40% of all cancer can be prevented with dietary measures. These are a few of the foods that can increase your risk of cancer. So soya, there's a link between the protein found in it and tumors increasing in the body. A high glycemic diet, which means a diet that causes your blood sugar to spike, can cause gastric, digestive, endometric, ovarian, and colorectal cancer. And it's also been found that cooked red meat is related to breast cancer. The National Cancer Institute has set some guidelines to help you prevent cancer. So keep a correct body weight, vary your diet, eat your fruits and your vegetables. You want to eat foods rich in fibers like cereals, whole wheat, flour, and beans. You want to limit the consumption of alcohol. You want to limit your consumption of salt. And you want to reduce the consumption of fats. Pathogens can be things like bacteria, viruses, parasites. Now, it's been proven that bacterial pathogens like H. pylori have a direct role in cancer. So H. pylori is going to increase your risk of getting gastric cancer. So because of this research that was done, it fueled more research into the idea that bacteria can cause cancer. Now, it's a complex process, but basically the bacteria causes inflammation, and this inflammation can cause your cells to mutate. Also, the bacterial products that are left behind can mutate your cells. We all know that radiation causes cancer, but did you know that radiation is everywhere? Radiation is energy that travels through space. The most common form of radiation that you get are UV rays, which is found in the sun. There's also radiation that's used in medicine. You get it from space, the air, the earth, the rocks, when you fly an airplane, when you go through an X-ray machine. Radiation has enough energy to damage your DNA permanently and cause cancer. Environmental hazards, so things that happen in the environment or events that threaten the natural environment, like pollution, toxic chemicals, physical agents, things that come from human activities or just things that happen in the earth naturally can affect the health of those exposed. So pollution can cause cancer of the lungs. Working on roofs and handling asbestos can cause cancers in the lungs too, like mesothelioma. Now I want to talk a little bit about stress and how it relates to cancer. So stress is what people feel when they're mentally, physically, or emotionally pressured. It's normal to feel stress from time to time. But there's a problem when you have high levels of stress and it happens over and over and over again. This can be caused by your daily life and routine things, and it also can be caused by things that don't happen too often, but has caused trauma, or maybe you're sick. So basically, when people are unable to manage things in their life, they become stressed or distressed. How does your body respond to stress? It basically starts releasing stress hormones. The stress hormones increase your blood pressure, speeds up your heart, and it raises your blood sugar. This helps people act with more strength, and it helps you speed up because your body feels like it has to, like it's trying to escape something. It wants to get away. It doesn't like the situation that it's in. So when you have all this stress, It causes havoc on your digestive system, causes fertility issues, it has urinary problems, and it causes you to have a weaker immune system. Stress and cancer, it hasn't been proven that stress can actually cause cancer. There's been studies that show a link between it, but there's also others that show there is no link. Technically, what happens is that when you're under stress, you develop bad coping behaviors, like smoking, overeating, or maybe drinking, which can all increase your risk of cancer. People who have cancer might find the physical, emotional, and social effects of the disease can be stressful. Now, if they start to try to manage their stress of the cancer with smoking or drinking, it's going to result in a poor quality of life after your cancer treatment. Those that use coping techniques to deal with stress caused by cancer tend to have lower levels of depression, anxiety, and symptoms after their cancer treatment. But there is no evidence that management of stress can improve cancer survival. Stress can cause tumors to grow and spread. There was a study done on mice who were implanted with human cancer cells. Now, when they were stressed out, they were isolated from the other mice, and their tumors would grow and it would spread. It's thought that the stress hormones promoted the growth and the metastases of the cancer. There was another study done with women who had breast cancer who were using beta blockers. Now, what beta blockers do is that it interferes with stress hormones. They had a better chance of surviving without relapse than women who didn't use the beta blockers. Now, there's no evidence that stress affects cancer outcomes, but there is data that suggests that patients can develop helplessness or hopelessness when stress becomes too much. Usually, those people have a higher rate of death, and it seems to be unclear why, but it's thought that people who feel this way tend to not seek treatment or give up too quickly. So how do you deal with cancer and stress? You can use different approaches: training and relaxation, meditation or stress management, counseling or talk therapy, cancer education sessions, social support in group setting, medication for depression or anxiety, and even exercise. Support can help reduce your depression, anxiety, and disease and treatment-related symptoms. So cancer is scary, and it can be brought on by different things like smoking, a poor diet, pathogens, radiation, and environmental hazards. It doesn't seem that stress causes cancer, but it can put you at risk for developing cancer due to behavioral changes brought on by stress, like smoking and poor eating habits. Stress can increase the size of tumors, and it can cause cancer to spread due to stress hormones.